Does fibromyalgia really exist? How does someone get fibromyalgia? What does it even mean in the real sense? You might have asked several unanswered questions about fibromyalgia. But the bottom line is fibromyalgia is a real condition. Never believe its symptoms are imagined. It is a real condition. Welcome to this channel. This channel is dedicated to giving you industry as well as expert information about all spheres of health. If you are new to this channel, subscribe so you can be notified anytime we upload another information-packed videos. Also, check in the description below for some of our proven recommendations. Without further ado, let's begin. Fibromyalgia is a neurological chronic condition that affects the musculoskeletal tissues of the body. The disorder is mostly responsible for inducing discomfort, pain and fatigue in the muscles, ligaments, tendons and in the areas surrounding the joints. People who suffer from fibromyalgia are constantly confronted with intense pain that tends to reoccur on a regular time basis. The pain caused by the disorder is felt deep inside the muscles and in certain points called trigger points. A common feature to all people with fibromyalgia is the location of the pain. And to all patients, fibromyalgia pain occurs in the same trigger points. Although people with fibromyalgia perceive the pain at different intensities, they claim to permanently feel a different level of pain in their soft muscular tissues. An interesting aspect of fibromyalgia is that it can be very difficult to detect in some patients. The symptoms of fibromyalgia are common to many other conditions and therefore they can be misleading in establishing the appropriate diagnose. Although some of the symptoms of fibromyalgia may resemble those of rheumatoid arthritis, people with fibromyalgia seem to be in perfect health when they are examined by a physician. By this, revealing no signs of muscular dysfunctions. Basic physical examinations and common laboratory tests usually don't reveal the presence of fibromyalgia. This is due to the fact that pain, fatigue and discomfort are mentally induced to patients with fibromyalgia, as a consequence of abnormal activity of their nervous system. Although they show no physical abnormalities or dysfunctions, their experienced pain is real. Abnormal brain activity is considered to be the main cause of fibromyalgia. There are two areas of the brain thought to be involved in the process. A high output of the mesencephalon, which is the upper region of the brain, accelerates the heart rate. Also, it increases blood pressure and raises the body temperature. People with fibromyalgia often experience sudden changes in body temperature and sometimes they sweat abundantly and even have fever. Not only that, a high activity of the mesencephalon is responsible for difficulties in falling asleep and in constant sleep patterns. Most people who suffer from fibromyalgia have trouble sleeping and in some cases they even suffer from insomnia. Therefore, the cause for fibromyalgia lack of sleep is thought to be the abnormal activity of the mesencephalon. The permanent fatigue felt throughout the whole body by people with the disorder is amplified by inappropriate sleeping patterns, unrefreshing sleep or insomnia. Another part of the brain that is considered to be responsible for inducing other fibromyalgia symptoms, which are anxiety, depression, lack of concentration, poor cognitive abilities, loss of short-term memory and confusion, is the cerebellum. A lower activity of the cerebellum is thought to be the cause of other fibromyalgia symptoms and the majority of people who suffer from the disorder reveal abnormal activity of both cerebellum and mesencephalon. Fibromyalgia is considered to be a serious condition. Due to the chronic character of fibromyalgia, patients require ongoing treatment and therapy. If left untreated, fibromyalgia can cause other symptoms such as nausea, loss of appetite, abdominal pain and swelling, vomiting, and internal distress. Many people with fibromyalgia also seem to become depressed as the disorder develops and sometimes they even indulge in suicidal acts. Ultimately, it is vital to spot the presence of fibromyalgia in time and appropriate measures must be taken in order to prevent further complications and undesirable effects. That is it for today's video. Like, comment, and share this video so other people can get the information about fibromyalgia. Also, subscribe so you can get the notification anytime we upload another informative video. Remember to check out some of our recommendations in the description below. Until next time, stay healthy.